Good afternoon. Today I'll be presenting about glutaric acidemia type 1. Glutaric acidemia type 1 is an organic acid condition in which the body has inadequate levels of the glutaryl-CoA dehydrogenase enzyme. This is a rare condition that occurs in 1 in every 100,000 individuals. In the United States, this condition occurs in every 1 in 40,000 newborns. However, there are places where GA type 1 is more common, like in the Amish community in Pennsylvania and in Ojibwa, Canada, where the prevalence is 1 in every 300 individuals. Glutaric acidemia is caused by mutations in the GCDH gene. A mutation in this gene prevents the production of the GCDH enzyme that is responsible for breaking down amino acids lysine, hydroxylysine, and tryptophan. If the enzyme can't be produced, this causes a buildup in the amino acids to an excessive level. Abnormal levels can cause brain damage and lead to movement and intellectual disability, along with other symptoms of GA1. The most common symptom of glutaric acidemia type 1 is macrocephaly, or an enlarged head at birth. Other symptoms include poor appetite, vomiting, fever, and delayed development. Since the mutation affects the area in the brain that controls the movement, an individual can also experience hypotonia or decreased muscle tone, twitching, and muscle spasms and seizures. Symptoms also include brain swelling and hemorrhaging. Glutaric acidemia type 1 is an autosomal recessive disorder, meaning that there's a mutation in each of the genes of the cell. With autosomal recessive disorders, it's possible for the condition to skip a generation. This is because parents can be carriers of the condition and show no signs or symptoms, but when they reproduce, it's likely that their child can inherit and be affected by the disorder. Here's a sample pedigree of GA1 consisting of 4 generations. The faint red spots symbolize carriers of GA1 with the blue marks, and the blue marks symbolize individuals that are affected with the disorder. We can see the disorder skip a generation with Vince and Meredith's family. Vince is a carrier because both of his parents are carriers, and Meredith has GA1. Together they had Paul and Taylor, who are both just carriers. However, we see that Taylor reproduced with Cole, another carrier, and had one daughter who's affected with GA1 and another daughter who's neither affected nor a carrier. This is because with Taylor and Cole's genotypes, there's a 25% chance of producing a child that will be affected, a 50% chance that the child will be a carrier, and a 25% chance that the child won't be a carrier or affected. So there are a few ways for an individual that can test for GA1. These tests include newborn screening, carrier screening, and prenatal screening. Glutaric acidemia type 1 is one of the mandatory disorders that are part of the newborn screening panels. This test is done within the first 24 to 48 hours of life and is mandatory for the purpose of providing early treatment. Physicians use tandem mass spectrometry of the heel stick and identify the disorder by the presence of glutaric acidemia covalently bound to carnitine. If the screening results turn out to be abnormal, confirmation is done by quantitative analysis using blood or urine, mutation analysis on the GCDH gene, or enzyme analysis in leukocytes or fibroblasts. If you find out that a family member is affected by glutaric acidemia, you have the option of undergoing carrier screening by submitting blood, urine, or skin samples. Ordering for this disorder are available online on Invitae, GeneDx, and Prevention Genetics. If you are pregnant, prenatal screening is available to see if your baby will be affected before he or she is born. Testing during pregnancy is done by amniocentesis at 15 weeks. Enzyme tests. This is an enzyme test done on the cells of the fetus. Glutaric acidemia is detected by elevated glutaric acid in amniotic fluid. This type of testing is only available if both parents are confirmed carriers for the disorder. Glutaric acidemia can be treated with medication, blood tests, and effective food plan. Individuals with GA1 can be prescribed riboflavin, which is medication that helps the body use protein and removes glutaric acid from the blood. They can also be prescribed L-carnitine, which helps the body make energy. An effective diet can also help with GA treatment. Individuals are advised to have a low lysine and low tryptophan diet. Some examples of foods to avoid include milk products, meat and poultry, nuts, dried beans, and peas and fish. It's also important for an individual to do routine blood tests to manage their amino acid levels. In summary, glutaric acidemia type 1 is an autosomal recessive disorder that is caused by mutation in the GCDH gene, which results to abnormal levels of amino acids. This disorder affects the area of the brain that's involved in movement, so it does cause muscle and developmental issues. Newborn screening is mandatorily done at birth, but carrier and prenatal screening are also available. This disorder can be treated with medication, routine blood tests, and an effective low lysine and low tryptophan diet. This concludes my presentation. Thank you, and I hope you all enjoyed this course.